Hi, my name is Jen. I'm a veterinary technician, and today I'm going to go over how to administer subcutaneous fluids to your pet at home. The first step is going to be gathering all of your supplies and making sure that your bag of fluids is set up before you go and get your pet. So typically we will start with a 1 liter bag of fluids of the correct type for your pet. Your veterinarian should provide an IV line that will attach to that bag. If it is not already set up for you, you will need to do that at home. So this line will come with a cap on the end with a sharp spike here. You don't want to touch that to the table or any other dirty surface. You want to keep that as clean as possible. You're going to remove the little rubber stopper from the top of the bag. You're going to insert that spike into your bag. It requires a little bit of force, just a little bit of twisting. And then you're going to hang that bag up. And as you do so, you're going to see the fluid flowing in this chamber right here. Then you're going to see it flowing into your line. Now, as you do that, you'll see that there are some air bubbles in the line. Although we're not giving this intravenously and are not going to give an air embolus with that, it could be uncomfortable for your pet. So we advise getting rid of those air bubbles by running this line over a towel or the trash. To do so, you're going to want to open the cap on the end of the line. So you're going to take that off of there. And being careful not to touch the ends of the line to any dirty surface like the trash or the table. You're going to open this little controller that's attached to the line and watch the fluids drip in the line until you don't see any more air bubbles in that line. Sometimes that will take just a few seconds. It's not a large volume of fluid. Once you're satisfied that you don't see any air bubbles in the line, you're going to stop it using this little controller here. On this particular line, you roll the ball down to stop the fluids. You then are ready to attach the needle to administer the fluids. Now, if you have a very small patient, a very skinny little kitty, you may want to use a slightly smaller needle. Typically for dogs and bigger kitties, we'll use an 18 gauge needle. Typically it's tolerated very well, and the bigger the needle, the faster it will go. So when you get your needle, you're going to twist the cap off the end, and then that needle pushes right onto the line. Twist this little device onto the needle to hold it in place, and your bag is all set up and ready to give the fluids. Okay, now that we have our fluid bag all set up and we have our pet, we're ready to give the fluids. Now, one thing you want to keep in mind when you're giving the fluids is that you're going to want to hang them up somewhere high so that you'll have gravity to help push the fluids down into your pet. Now, you're not going to have an IV pole at home, so I usually recommend hanging a coat hanger through the top of the bag and then hanging that over your kitchen cabinets or a door jamb or a lamp. I usually will give the fluids at home on top of a counter. Some pets are squirmy and may try to escape, so you may want to try to do it in a laundry basket or a box if that's the case. So usually we give the fluids under the skin over this loose skin over their shoulder blades. This area doesn't have a lot of nerve endings and blood vessels that you're going to hit. It's usually tolerated very well right there. What we're going to do is we're going to take this loose skin here and we're going to pick it up away from the muscle and tissues underneath. We're going to make a little pocket where our needle is going to go in, where we're going to administer the fluids. The needle is going to go right into that little tent that you're making with your fingers, not up into your fingers or down into your kitty's back. So the needle is going to go at about a 45-degree angle under your fingers, again, not down into the back. All right, so when we're ready to give our fluids, again, we're going to pick up that skin away from the muscle and tissue underneath, make that little tent. We're going to put the needle right into that little pocket. Once it's in there, you can let go of the skin. I usually just kind of gently hold the line in place so it doesn't pull out. Then I'm going to take the little controller and roll that little knob up. And once that's up, you'll see the fluid dripping in this little chamber. And the faster it's dripping in there, the faster it's going into your pet, which is great. If it's not flowing very fast, sometimes just gently moving that line side to side will help it to go a little bit faster. As you're giving the fluids, you want to carefully watch the level of fluids. This bag, we're starting at 0, so this line is above the 1. We're gonna give Willis 100 milliliters, so we're gonna watch that line go from here at 0 down to the 1. Now, each of these lines on the side here, 1, 2, 3, are 100 milliliter increments. You wanna make sure that you administer the correct dose to your pet. And as you're administering that, you should see that the fluid line should drop. Once you have reached the appropriate dose, you're gonna take that controller, you're gonna roll the knob down to stop the fluids. Then you're gonna pull that needle straight out and sort of gently pinch the skin to make sure that there's not any fluid coming back out of the site. You may notice that as you let go of that there will be a little bit of dripping of fluid from the site. That's normal. You can take a tissue or even just gently pinch with your fingers to stop that. It usually will stop within a minute. Sometimes you may even notice that it's a little bit pink tinged. That can be just from a little bit of skin bleeding. That is normal following giving fluids. Now, as you give the fluids, you'll notice that there's fluid building up underneath the skin. It will feel like a little pocket. After you've given those, you may notice that with gravity that it can settle down into the armpit, down to their side. I've even seen it go down into their leg. That's completely normal and it will still get absorbed at those locations, but it should be absorbed within several hours to a day. When we are done administering our fluids, you want to remove the needle by untwisting this little cap holding the needle on the line. And then you're going to twist the needle off and dispose of that in a biohazard or sharps container so that it doesn't go into your trash. You're then going to recap the end of the line with the little cap that came with it. If you have misplaced that cap, you can use a new needle. You want to make sure that you use a new, fresh, clean needle each time that you give the fluids.